My name is Dr. Aaron Jacoby. I'm the director of the Mental Health Clinical Center, and I'm here today on behalf of our acting chief of staff, Dr. Vishal Vaghela, who sends his apologies that he could not join us today for this meeting. When the PACT Act went into effect in August 2022, it was the largest expansion of healthcare and benefits in VA history. And in March 2024, a further expansion made even more veterans eligible for VA healthcare. So, whether you've heard of the PACT Act or not, we're glad that you're here today because we want all veterans to be informed so that they can receive the healthcare benefits they've so deservedly earned. So today, you will be hearing from two individuals who can best explain the latest updates on the PACT Act and as they relate to VA healthcare eligibility as well as toxic exposure. Chandra Epps is our lead medical support assistant in enrollment and eligibility. Ashley Hanahan is our toxic exposure screening navigator. After their presentations, we'll open the session for questions, and we've assembled a panel of subject matter experts from VA Maryland healthcare system, as well as our partners from the Veterans Benefits Administration and the Maryland Department of Veterans and Military Families to address any questions you might have. Our session today will be recorded and made available online for those who are interested but could not join us today. You will be able to find the link to the recording on our website, maryland.va.gov, within a few days. To protect your privacy, please do not share any personal health condition or any personal identifiable information during the question and answer portion at the end of this session. Before I turn things over to Ms. Epps, I'd like to give you a brief overview of the PACT Act. So many of you who have heard of the PACT Act know that it greatly expanded VA healthcare eligibility to include many more individuals. But what it also did is it increased infrastructure for VA to be able to provide care to veterans. So it strengthened our VA workforce. It also authorized funding for VA facility leases. It tried to streamline and increase VA benefits claim processing capacity to make sure that more veterans could get the benefits that they've earned. As you'll hear later, it bolstered our VA toxic exposure screening program, and it also made sure that we could engage in research to better understand the impact of toxic exposure on veterans. And lastly, what the PACT Act did is it actually improved VA's presumption decision-making process to essentially help more veterans engage in care. Right. I'm going to turn things over now to Ms. Epps to provide more information about how the VA healthcare eligibility was expanded under the PACT Act. Are you ready, Ms. Epps? Trying to see if you're on mute. I mean, do we know if Ms. Epps is having problems with her mute?
We don't. I know that she was on and we tested, so I am looking if everyone can just hang on for one moment.
Problem. I'm also trying to find if she maybe got disconnected.
She might have gotten kicked off because she was here earlier, so we are.
I don't see her here any longer. Well, why don't we do this? We'll move on to Ms. Hanahan, so we can move forward, and then we'll see if Ms. Epps can join us, and we'll do things in reverse today. How's that sound?
That sounds like a great idea. Thank you.
Sure. Okay.
Good afternoon. My name's Ashley Hanahan, and I am a nurse practitioner and the program manager for compensation and pension in the VA Maryland healthcare system. I'm also a toxic exposure screening navigator and a registry clinician. And I'm happy to be here today to talk to you about the PACT Act and toxic exposure screening. Just waiting for the slides to catch up. Thank you. All right, next slide, please. So, as Dr. Jacoby mentioned, the PACT Act really provided a huge expansion of clinical services, support, and also eligibility for care and benefits for many veterans that were previously ineligible for different reasons. But one of the most important things about the PACT Act from the clinical standpoint is that the PACT Act stands for the promise to address comprehensive toxic exposure. And so there is now a formal recognition of the importance of considering environmental exposures in veterans and how that affects their health, which can in turn affect eligibility for benefits as well. So one of the things that has been a top priority for those of us on the clinical side of the VA is to perform something called toxic exposure screening. And so I just want to take a minute to review exactly what toxic exposure screening is. All veterans who are enrolled in VA healthcare are eligible for this screening. It's a brief questionnaire, essentially, takes about 5 to 10 minutes to identify and document any potential exposures to toxins. The screening is to be done every 5 years, and it's performed at VA medical centers, clinics, including virtual or like telephone encounters. And why are we doing this? Well, it's to support the overall health plan of the veteran, ensuring that they're receiving what we term as whole health care, but really moving towards exposure-informed care. We no longer think of environmental medicine as really a specialty per se. We really are ramping up our efforts so that all clinicians are more well-versed in these exposures. Next slide, please. Thank you. So as Dr. Jacoby mentioned, PACT Act really expanded a lot of eligibility for care. One of those things that was significantly impacted was the addition of many what are termed presumptives of service connection. And for those of you in the audience who may not be as familiar with service connection and what presumptives are, a presumptive condition is one that the VA has formally recognized as a potential complication of exposure to a particular toxic substance. And so when a veteran files a claim for that condition, if they are meet the terms of eligibility, which pertains to the DD 214, the dates of service, and possibly deployments or where you were located for these exposures, you can become service connected without having to provide any additional proof that the condition was potentially related to your military service. The PACT Act expanded benefits and presumptives for all kinds of exposures, including Agent Orange, but probably the greatest impact was really for Gulf War and post 9/11 veterans. This is a listing of conditions that are considered presumptive owing to some exposures. And in the right-hand side, you can see for Vietnam veterans and others exposed to tactical herbicides. And just a brief mention about Agent Orange, not only did it expand the number of conditions, but it also expanded the territories to include other areas other than just Vietnam, and including what's referred to as blue water veterans who are within a certain mileage range off the coast of these areas where spraying occurred. Next slide, please. So another term that you may hear in filing for benefits with the VA is a TARA. And a TARA stands for a toxic exposure related event or occurrence that's specific to certain exposures that would have occurred during your active duty service. And exposures are many things. They may be particular to a conflict, such as burning oil fires and Gulf War exposures, or they could be things that are very specific according to your occupation. So, for example, if for those that worked in mechanics, it might be exposure to solvents, to petroleum, to lead paint, and so forth. Other types of exposures include things like radiation, ranging from ionizing radiation, which is high level radiation, to even lower level but chronic exposure to radiation, such as nuclear weapons technicians, dental technicians, and so forth. And then, of course, things like warfare agents that would include chemical and biological weapons. This is not a comprehensive list, but it's just meant to basically say, there's just multiple points where a veteran could be exposed to any or all of these things. There is a very helpful website that the VA has organized. It has online, which is publichealth.va.gov. And if you've never been to that site, I do highly encourage everyone to take a look at that site. It's very user friendly. It has important links to the presumptive conditions for specific exposures, and it also provides links on how to file a claim for benefits. Next slide, please. Okay, I just want to touch briefly on filing and processing claims, because that could be probably a presentation in and of itself. But again, there is a link up here at the top, va.gov/PACT, that really outlines a lot of detail about the PACT Act, eligibility, and again, conditions relating to exposures. But the main thing I wanted to highlight here is that veterans who were previously denied a toxic exposure claim are encouraged to file a supplemental claim using VA Form 20-0995, which is a decision to review, meaning a re-review of a claim that was filed previously. If you've never filed a claim, of course, you would want to submit a new claim on the VA Form 21-526EZ. And the most helpful thing really is to go to va.gov website. One of the first links on the website is how to file a claim for benefits. You can register for an account called eBenefits. You can file a claim yourself electronically, or you can also use paper and pencil, or use the assistance of a veteran service officer who would be a subject matter expert in helping to file your claim. But the main thing I wanted to encourage veterans is that if you were previously denied perhaps a condition, for example, related to Gulf War exposures, I would encourage you to look at publichealth.va.gov and consider either filing or submitting a supplemental claim. Next slide, please. To learn more about the PACT Act, there's a link here for www.va.gov/PACT. There's also links here for applying for health care, for a VBA claim for benefits. And then specifically, there is a website here about the open airborne hazards and open burn pit registry. Not to single out that particular registry, there are 6 official registries, but there's certainly a way that you can undergo a military environmental exposure examination where we spend considerable time talking about all of your exposures. And my contact information is on one of the slides that's coming up. You're welcome to email me, but I will forewarn you that sometimes emails from external sources do go to a spam or junk folder, and I may not see them. So I would encourage you to contact me directly by phone. And if you're not able to reach me directly, I will get back to you as soon as I possibly can. And I'm happy to answer questions about the registry, help schedule you for an environmental registry exam, and also speak to you about benefits and how to go about that process. If you're new to that, it can be a little overwhelming sometimes. Next slide, please. Here's some general contact information and phone numbers. And I'm going to turn this presentation back over to Dr. Jacoby. Thank you.
Thanks so much, Ashley, for this incredibly informative overview of toxic exposure. Going back, Ming, were we able to get a hold of Ms. Epps?
Yes, she is on the line now.
Oh, fantastic. So, Chandra, I know you're going to
Take it
talk
away.
to, yeah, take it away. Thanks.
Hi, Yeah, my computer had issues. I don't know what happened. My apologies. But so I'm gonna talk to you guys about the PACT Act and what's the qualifications in order to be eligible under the PACT Act. Next slide. All right, so veterans first must meet the minimum active duty and discharge requirements to qualify for VA healthcare under the PACT Act. So back in March 5th of 2024, three new cohorts have came about that the veterans um, each should qualify. It determines if they're eligible for the PACT Act. Next slide. All right, so cohort one consists of veterans who participated in a toxic exposure risk activity, which is terror, as defined by law while serving on active duty for training, or inactive duty training. Cohort two consists of any veteran who were assigned to a duty station in certain locations during these specific times. So on or after August 2nd, 1990, they would have to they had to get deployed to one of these locations: Iraq, Kuwait, Qatar, and also on or after September 11th, 2001, Afghanistan, Egypt, Jordan, Lebanon, Syria, Uzbekistan. Veterans, so cohort 3 is veterans who were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, or uh, Resolute Support Mission. Next slide. Okay, so what is considered terror? So terror is veterans who was exposed to one or more of these following hazard conditions. If they was exposed to air pollutants, chemicals, occupational hazards, radiation, warfare agents. This is more, it's more list, but this is just the breakdown of certain ones that's majority people complain about that they file claims for. So here's a website that has more lists that they can file for. Next slide. All right, here's some more locations that veterans could be deployed to. August 10th, 2002, Republic of Vietnam, Thailand, Guam. All right. Next slide. All right. So, what is the minimum active duty requirement? So, veterans must have served 24 consecutive continuous active duty or the full period of which they were called or ordered to active duty. Reservists and National Guard are eligible for VA health benefits if they have one of the qualifying factors listed above or one of the health eligibility requirements under the PACT Act, which is terror. If they have one of those qualifications. Former members of the reserves or National Guard who only serve for training purposes will not be eligible because they didn't have a qualifying disability during the training. But there are exceptions. So any exceptions that they might have is they was discharged or released for a qualifying reason, either early discharge, a hardship, or a medical discharge. A veteran was discharged for a disability that caused or made worse by active duty service, or if they were entered before September 7th, 1980, they had to at least do 1 day of active duty. So the VA do encourage all veterans to apply to determine their enrollment eligibility. They can visit va.gov and click on healthcare for more information. Next slide. All right, there are 4 ways the veteran can enroll in health care online at va.gov. They can click on the healthcare button that's located on there, and it'll take them prompt by prompt to apply. They can also call the toll-free number 855-976-1093. They can also mail a VA form 1010EZ to the Health Eligibility Center located in Atlanta, Georgia. They can also come in person to the VA, one of the VA locations, the main one in Baltimore, or they can go to Prairie Point. Next slide. Okay, so why choose VA? So VA provides the best and affordable health care for veterans. VA health professionals are trained to understand and know the veterans because most of them are veterans themselves, so they understand them. VA healthcare has copays low as $0 for prescriptions, urgent care, outpatient care, and more. It also has been proven that VA has beaten non-VA hospitals in ratings and patient satisfaction. So if a veteran has previously applied and was not found eligible for VA healthcare due to income, lack of service connection, or other factors, they may now be eligible. So they could either go through the 4 ways that I went before online, call the toll-free number, they can come in person, or mail a 1010 EZ to the Health Eligibility Center and get reassessed. Next slide. Okay. All right.
All right. So thank you so much, Ms. Epps. That was very detailed information. And I wanted to take some time to thank both Ms. Hanahan and Ms. Epps for their informative presentations today. We're going to now transition to the question and answer portion of our session. Just a reminder, to protect your privacy, please do not share any personal health condition or any personal identifiable information. You can post your questions directly to the chat, or if for some reason you can't access the chat, you can email questions to vamhcspublicrelations@va.gov. That's VAMHCS public relations altogether at va.gov. And once we receive that, we'll drop that address right into the chat. Okay, so I know we already had a question in the chat. I'm going to just summarize it. So we had a question earlier. Even though an exposure was deemed quote unquote service connected, what is the burden of proof for that exposure to be deemed a disability that will grant compensation from VA? And it was already answered. Essentially, what would be required is a diagnosis of that presumptive condition. Okay, let me move down and see some other questions in the chat. Okay. I'm interested in finding out more about VA dental coverage for 100% disabled veterans. Can you provide a good Maryland VA POC representative and/or contact information? If practical, can you describe this benefit and how it works? Okay.
Okay.
So, go ahead.
Yeah. So in order to be eligible for dental here at the VA, you have to be 100% service connected PNC, permanent and total disabled, to be seen, or have a service connection related to dental in order to be seen through dental. I'll list the number in the chat. I'll write the dental department number in the chat. And you can reach out to them if you're qualified for the dental.
Thank you, Ms. Epps. And we have the slide with the contact information and phone number. It's showing on the screen right now, and it includes a lot of really great numbers for reaching out for various questions. Okay, let me take a look at the chat. And we had a question here: what determines chronic sinus?
Dr. Jacoby,
that was related to, yeah. Go ahead, Ms.
Yeah, this is Ashley. Sure, I'll take that question. I think to highlight an answer you gave earlier that wasn't covered in the presentation, which is that when you have a presumptive condition, or if you think you have a presumptive condition before you file a claim for benefits, you do want to receive the medical evaluation, and having been given that diagnosis of a condition, in order for VBA then to put forth your claim for benefits. With regards to chronic sinus, that's probably something better I can discuss individually with you. If you'd like to contact me, on my information's on the slide. I'm Ashley Hanahan. But specifically, it's a little variable. It depends if you're talking about chronic allergies versus actually sinus infections, and it gets a little bit more into the weeds in that regard. But with regards to Gulf War exposures, really what we're looking at is chronic rhinitis, which is chronic inflammation of the airways, chronic congestion, that sort of thing. But again, you're welcome to contact me to discuss any individual details about your health history.
Thanks, Ms. Hanahan. And we also have, what about fatigue Gulf War syndrome?
Yeah, again, it's a little bit of a complicated condition, because generally Gulf War syndrome is considered a diagnosis of exclusion. And what that means is that you've had a medical evaluation to evaluate for more common causes of chronic fatigue, which is, obviously a widespread complaint, and it can be a symptom of multiple conditions, including sleep disorders, anything rheumatologic, such as Lyme's disease. It can be multiple causes. So it first would require some evaluation for that condition before the diagnosis of Gulf War related illness is rendered. Again, you're welcome to contact me directly to discuss any personal details of your case, or a family member, or on behalf of a friend.
Thank you. And we have an additional question specifically from Roxanne. She asked, would getting rid of CT trash in burn rooms overseas be considered to fall under the PACT Act? And,
this is Ashley. With regards to eligibility for benefits or filing a claim, a lot of what pertains to the burn pit registry and burn pit related claims is specific to certain times and locations of where you were overseas. It's not always related to an occupational situation. That being said, you can certainly file a claim nonetheless for any type of exposure. It may or may not be a presumptive, but there's no, you can certainly still file a claim. And like I said, you're welcome to contact me directly if we wanted to look at your DD 214 and some things like that.
Thank you, Ms. Hanahan. Another question, this is from Will, asking, when applying for VA healthcare with an 80% disability rating, but also having employer coverage, there's 3 questions. Does the VA healthcare cover me, wife, and dependents? So that's the first question. Second question is, can I use VA healthcare as primary and unenroll from the employer plan? And then the third question is, there a fee associated with this care? Ms. Epps, do you want to take that one?
Yes. So the VA does only covers for the veteran. We don't cover for
It seems like Ms. Epps got muted.
I'm sorry. I don't know what's going on with my computer today.
No problem. Take it
But
away again.
So the VA only covers for the veteran. We do not look at dependents. So the dependents will have to be enrolled in it's called Chant VA. They have to reach out to Chant VA. Far as your outside, we don't tell people to unenroll in their outside provider. It's up to you. We don't tell you to disenroll yourself from that. You can have 2. You can have your outside provider and the VA as a benefit. Far as the fee, each veteran is placed into a priority group depending on their status, and each veteran it depends on what their priority group is to see if they have copays or not. So it's really not a fee. It's really just like copays that you have for medication or primary care services. So it all depends on your priority group.
Thank you, Ms. Epps. And whenever a veteran comes into enrollment and eligibility, they'll conduct a means test. They'll get
Yes,
a
a means
sense of,
tested
yeah,
to
yeah.
determine what priority group you'll be placed in.
So those are great questions, and I want to underscore we do have a lot of veterans who are enrolled in care here. They also will receive care in the community. They often have private insurance, and we just ask that veterans communicate with us to let us know that they have other insurances. And a lot of times we can really maximize the benefits that you're getting here, as well as with your private insurance company. So those are all really great questions. Okay, we have a few others here. So Linda asks, does the medical evaluation and diagnosis for a presumptive condition have to be done at VA, or essentially can it be done elsewhere?
That's an excellent question, and the answer to that is no. The diagnosis, evaluation diagnosis can occur anywhere. It does not have to be done within the VA, but it is important to obtain records when you're filing a claim. It really does help to expedite the processing of a claim. The VBA will assist with obtaining records if you're having difficulty getting copies of records and so forth, but I always encourage veterans to submit records with claims whenever possible.
Thank you, Ms. Hanahan. That's a great recommendation. It always helps us to see as much information as possible. Dennis asks, so to schedule a toxic exposure screening, we can start by calling Ms. Hanahan at the following number, 410-605-7671.
Yes, that is correct. The only thing I would say is that it is important for you to be enrolled in our system, and that essentially creates a medical record so that we could document your toxic exposure screening. Otherwise, I don't have a means by which to document your examination or the screening process. Even if you're not enrolled, you're certainly welcome to call and ask me questions and so forth. But as far as getting the formal screening done, we would need to have a file created for you in our system.
Thank you. Okay. Cindy asked, if someone doesn't currently receive VA healthcare, would they be able to see a VA doctor for a presumptive diagnosis, or would that have to be taken care of outside of the VA? So kind of a similar question. And it sounds like, based upon what you said, Ms. Hanahan, we can get diagnoses from outside, but enrollment in VA is important.
Yeah, I would agree with that, Dr. Jacoby.
Amy asks, I am recently retired, honorably discharged with no disabilities, been denied registration into VA healthcare. With the PACT Act, am I now eligible for VA healthcare, or is it still based on disability, toxic exposure, and or service-oriented issues? Ms. Epps, do you want to take that one?
Yeah, so with that, if your DD-214, if we don't have a DD-214 showing the toxic exposure or any of the terror cohorts, we would naturally send a HEC alert to the Health Eligibility Center, and then they will dig deeper to see if you were to exposed to any of those toxins, and then they will send a determination letter out to you, and then you can start the process over again to reapply for VA health benefits.
Yeah, I think that's an excellent answer. And I will say that I've worked with a number of veterans myself who have had to navigate understanding some of the eligibility, but I always encourage people to remain persistent. We can usually find ways, to get people engaged in some level of care. Timothy asks, if previously stationed at a base that has been determined to possibly have TARA, such as Camp Lejeune, Fort McClellan, are these covered by the PACT Act? Chandra, do you want to take that one?
I know. So usually when someone comes in and say they were in Camp Lejeune, we send out a heckler as well, and they will determine if they seen that, and they'll send a letter out, and then they'll update it. Sometimes they'll update it in the chart for us.
Yes, thank you. And it looks like we have a question regarding the phone number. Terrence asks, what's the phone number for information on hearing tests? I know we don't have that on our slide that we're sharing right now. Ming, do you happen to have something at your fingertips for audiology? We can put that in the chat. So we'll come back to the number for audiology for scheduling. Okay. Next question from Mike. Does TDY to Guam prior to 1980 apply for presumptive for prostate cancer, and do I need TDY orders? So this is prior to 1980. Do we know, Chandra? Oh, I'm sorry. Go ahead, Ashley.
That's quite all right. I can at least speak to part of it. Guam is covered for presumptive for Agent Orange related exposures. The dates I'm not 100% on. I would need Shonda to answer that. What I would suggest is two things. One would be to check the publichealth.va.gov website. There is a very elaborate website on there for Agent Orange or dioxin related exposures, and you may get your answer there. The other thing would be to contact VBA directly or a veteran service officer, as they are in the habit of filing claims routinely and know a lot more about some of these details.
Yeah, excellent answer, Ms. Hanahan. Chandra, did you have any information regarding prior to 1980?
So for 1980, they just have to do, before September 7th, 1980, they just have to do 1 day of active duty. So a DD-214 just has to show that 1 day of active duty.
Excellent, thank you. Okay, Bob asks, obstructive breathing diagnosis causing use of CPAP. Does this qualify for a claim?
If you have a diagnosis of obstructive sleep apnea, which is what this is sounding like, it's possible that it could qualify for a claim. You're welcome to contact me at the phone number listed here, and we could talk particulars about the situation. But it is a general statement. I'd just like to say that veterans reserve the right to file a claim for any condition that they feel may be related to military service. Those determinations are made by the Veterans Benefits Administration, but there's really sort of an open door policy with VA benefits for veterans to file claims. And so I always want people to walk away not feeling discouraged, but actually the opposite, more encouraged. Whether or not the answer will be yes is different, but it never hurts to file a claim.
Just wanted to add on to that. We also, over at the Veteran Benefits Administration, I'm Summer Jones. I work at the regional office in Baltimore. So we typically ask them if they have any conditions that they're diagnosed with that are presumptive of their service that's connected to the PACT Act. So if they have like sinusitis, hypertension, we can possibly connect it as a secondary condition. So that is an option as well.
Thank you, Summer.
Thank you, Summer. Okay, George asks, how does kidney cancer work, and do they reevaluate you after age 55? What I'll say, George, is that any questions regarding getting, reevaluation for any type of health condition, I think if you're engaged in primary care here, I would first have a conversation with your primary care physician. They can often direct you in the right direction. If you've received a diagnosis outside VA and you're looking for follow-up care, then I would recommend also speaking to the primary care physician so that we can get you connected with a specialist. We do have oncologists that are on our staff that work with veterans with an array of diagnoses of cancer. And I will say that the age requirements for reevaluation for risk for the different types of cancer does vary, especially, given premorbid conditions and other health conditions. So it's best answered by primary care if you're engaged. Okay. Bob asks, what are the 10 most commonly occurring conditions among vets related to Agent Orange? It's an excellent question. And I know, Ashley, you had mentioned that there was the website that we talked about in terms of Agent Orange exposure.
Yes, I'm sorry. I was looking for the question. Was the question the top 10
Top 10.
diagnoses?
Yes, most commonly
Top 10.
occurring conditions. Yeah.
Yeah, okay. Yeah, there is actually a long list on the website, and so I couldn't tell you necessarily with the frequency. But it is a very long list, and many of the conditions are common, and I'm just going to throw a few out here. So prostate cancer, diabetes, hypertension, coronary artery disease or ischemic heart disease, hypothyroidism, Parkinson's disease, and Parkinson's-like conditions, a variety of cancers, unfortunately, as well, including lung cancer. But for the complete listing, I would advise you to go to publichealth.va.gov.
Thank you. And then there was a question, I was denied VA benefits based on salary when filing. What is max salary allowed? Chandra, I know that that information changes with the benefits
Yeah,
package every year.
yeah. So the salary is based off of your zip code. So each zip code has a threshold. So it all depends. Everybody's zip code is different. So each threshold is different. So each amount is different. So it all depends on your zip code.
Thank you. And then another question, would a previously denied claim now considered a premature denial and open due to the recent presumptive conditions be favorable? Summer, did you want to speak to that? You're talking, we can't hear you, Summer.
Oh, yes, I was just reading the question again.
Oh, no problems. Okay. So it was from
Yeah,
Anne
so
Marie. Yeah.
yes, Miss Anne Marie. Yes, so you can file a supplemental claim. And as we mentioned earlier, please ensure that you are you have a formal diagnosis of the condition before you apply again. Yes, you can definitely reapply using a 20-0995. You do not have to include any new evidence as is presumptive of your service in OIF, OEF, burn pits, or Agent Orange. So, yes.
Thank you, Summer. And William has a question here. I've been trying to get a VA healthcare ID and the online service continues to give me an error. I've called the help desk to try and go about that way, and I never get anyone on the line. Is my only resort to go into a VA hospital and enroll that way? This is my initial enrollment. So Chandra, I know we have the 4 ways of getting people enrolled, and it sounds like William's been having a tough time with the online enrollment.
Yes, so he would, if you can't do it online, you can try the toll-free number or just visit one of the enrollment centers. So if it's because a lot of people did say that online it does give them trouble, so they do come in. So I mean, I feel like the in person is the best because you'll get your results right then and there in person. But you can call the toll-free number.
Thank you, Chandra. Okay, next question. And this is from Latanya. What if you have already been diagnosed with chronic rhinitis through the VA and are 100% permanent in total? Are there any additional benefits available? Summer, did you want to take that one?
Yes, so there are not any additional benefits available if you're already 100% and you are service connected for rhinitis. The only way for you to get additional benefits if you are above, if you have at least you're 100%, you have a 100% total rating for one condition and you have other conditions that are above 60%, you'll be eligible for special monthly compensation, but rhinitis won't push you above that threshold. So just want to let you know.
Excellent. Thank you, Summer. And follow-up question from, it looks like Reginald, was 100% permanent in total for 2 years, and I received a letter dropping me down to 80%. Reginald wants to know how to get that corrected. Summer, can you speak to just kind of the general process of when veterans receive such letters?
No problem. He can always contact us. You can always contact the National Call Center at 1-800-827-1000, and you can schedule a virtual appointment through the Veterans Engagement um, the Vera line, and we could go ahead and explain to you how we can get you back to that 100% rate. It just depends on why you received that reduction. So I need to know, we need to know more information regarding that. So yes. Yeah.
Thank you, Summer. And I see that Ara had a question about the PowerPoint, and Ming responded, we're trying to post it in the chat. In the meantime, you can email VAMHCS Public Relations at va.gov and we will send it to you. So thank you so much, Ming. And
Dr. Jacoby, if I can just add as well that the recording of this session, along with the slides today, will be posted on our website within 2 days, so by the end of this week, and that will be at maryland.va.gov under the stories section.
excellent. Thank you so
Okay.
much.
Thank you.
And it looks like the next question was already answered. Will had asked a follow-up question about CHAMP, and we provided clarity. It's CHAMP VA, and the POC or website. Did we drop that in yet, Chandra?
Yes, I put the number in the chat.
You did. Okay, thank
I
you.
put it.
I'm still catching up. And then Kenya very nicely put in here to schedule an audiology appointment. You can call the appointment center at 410-605-7333, and you can also use the VA's online scheduling tool if you have access. So thank you very much, Kenya, for answering that question regarding audiology. And Ming also very nicely have the slides and a nice set of detailed instructions to go to www.maryland.va.gov and then click on stories. And looks like Summer posted the link here for income limits, which is really helpful. Thank you. That was at 12:43. Bob asks, does VA have an ombudsman available for veterans who are suffering dementia? And so we have a very active geriatrics and extended care program. And certainly I can take your information down, Bob, and I can get someone from that team to reach out to you. I don't believe we have anybody on from geriatrics and extended care today, correct?
No, we don't.
Okay. But I will reach out and I'll make sure I connect you, Bob, with our head of the GEC to have some discussions about the type of provision of services that we provide for veterans who have dementia or other cognitive disorders related to the aging process. Looks like Anne Marie asked the VA reopened the claim, assigned light as third party. Okay, and then the number was provided. Joe asks, are presumptive VA claims filed the same as regular claims?
Yes. Presumptive VA claims are filed with the same way. So a 21-526EZ for new claims, for increases. If you are disputing a previous claims decision, you can use a 20-0995. Especially if it was years ago before the PACT Act became law, you can just apply using a 20-0995. So just want to let you know that.
Thank you, Summer. And then Ashley posted in the VBA phone line, 1-800-827-1000. Ms. Griffin also gave some really important information about the difference between the Veterans ID card, which we call a VIC, and the Veterans Health Identification Card, which is the VHIC, the VHIC. And so you'll see that in the chat. And then JT asks, follow up VA dental coverage information / links. Trying to see if we had anything posted in here yet. We will get that posted in the chat in terms of the dental coverage links. Roxanne asked, how can we get a veteran ID card? So
She could get the veteran ID card right on va.gov because it's a digital card.
So are you yeah, either card you can get online, or the Veterans Health Identification card you can either come in person to one of the enrollment centers or do it online for that. So it depends, the Veterans Health card or the Veterans Identification card.
Thank you. Thank you both. And then there's another individual who reached out. Linda says, I'd like to also get connected with resources for veterans with dementia. So I've written that down, Linda. Linda and Bob, I'll make sure that we get someone to get you information regarding the resources that we have. Okay. We don't see any other. Oh, no, hold on. Another thing just came into the chat. K Thomas says you have to be eligible together. Oops. You have to be eligible to gather cards, to get cards.
So for the Veterans Health Identification card, yes, you have to be eligible for the VA health benefit to get the card. You can't get it without being enrolled in the VA health benefit.
Gotcha. Thank you, Chandra. And Donna, also, I've added you to the list for dementia resources. Thank you for letting us know. And Kenya very kindly just entered the VA dental coverage information. You can click on the link, and they'll give you lots of information there. Okay.
Dr. Jacoby,
Cindy,
this is Ming again, and I'm going to enter the dementia person into the chat. Give me 1 minute, and I'll be entering that in the chat.
Thank you so much. Cindy asked, with regard to the PACT Act VA fair in that's on the 20th, is there additional beneficial information that we receive there, or has everything been covered here? It's a great question, Cindy.
Dr. Jacoby, I'll answer that one. This is Kenya. So for that event, it's in person and you have to register in advance, and it gives you an opportunity to speak one-on-one with the claims representative if you are either starting a new claim or updating a previously entered claim. It also allows veterans who have not enrolled in VA healthcare to work with a VA healthcare enrollment specialist to start that process. And then we'll have other resources available to veterans at that information fair. So you can go around and learn about more services available through VA healthcare or services for veterans in the community. So that event is mainly for one-on-one assistance with your specific issue. And you have to register first if you have that link.
Excellent. Thank you, Ms. Griffin. Appreciate that information. Gerard has his hand up, I believe.
Yes, good afternoon. Can you hear me?
Good afternoon. We can.
Yeah, I just wanted to make a point that we were addressing how the PACT Act affects veterans as far as disability compensation, filing supplemental claims, or filing on initial claims, but I did want to point out too that this also affects surviving spouses. We have a lot of veterans who may have been denied previously before the passage of the PACT Act and passed away. The surviving spouses can also, at this point, apply for dependency indemnity compensation for issues that were presumptive under the PACT Act. If the veteran died of any of these service-connected conditions, the widows can apply even though the veteran was not previously designated as service-connected. Or if the surviving spouse has been denied in the past, same would apply. We can go back and file a supplemental claim for that and get these survivors the benefits that they're entitled to.
Excellent. Thank you very much for providing that information. And I think that's really important for folks to hear, to recognize that, and we don't ever want to forget about the impact that, many of these experiences has on family members. And so it's a really good point. Thank you. Looks like there was some additional information that was placed in about VIC cards by Summer. Thank you, Summer. And some other comments. Says thank you. And I agree. Much to learn. This is very complex information. It's one of the reasons why we host these, because we want to make sure that people have as much information as possible. Ming had entered Sarah Barber. Thank you so much, Ming. And she is a social worker in our Dimension Clinic. She can be reached at 410-605-7000 and then extension 53754. Okay, Summer also added veterans who are service connected will have that annotated on their card and will allow them access to the commissary and the PX. So that's exciting. And then other positive comments. Thank you. Christopher says, I recently was granted benefits for sinusitis and rhinitis. How do I determine what private medical records were used in my determination? Well, that's an excellent question, Christopher. Summer, do you want to answer a little bit about the process of record review that occurs when claims are filed and processed?
No problem. So so on your decision letter, it will have a list of evidence. So you'll be able to see what the VA used to make a decision on your claim. And if you have any questions, you can always give us a call. We can go through your file and we can verify what was used. Again, you can use the Veterans Engagement Reporting Application, VERA. You can schedule a virtual appointment or an in-person appointment, and we'll be more than happy to explain it in detail for you.
Excellent. Thank you, Summer. Question from Ronald. Do VHIC cards get you access onto bases with VA healthcare centers? That's an excellent question. I do know that we here at VA Maryland have a community-based outpatient clinic right on the base at Fort Meade. And the VHIC card, I believe, Chandra, allows you to get onto base, correct?
Yes, as long as it says service connected, they're eligible to get on base. They just have to register the card at the Welcome Center.
Yeah, and that takes a little bit of time when you go to the Welcome Center. So
Yes.
if your first time is at Fort Meade, you want to build in a little bit of time for that. Okay, no, we're coming close to the top of the hour, but Linda asked, how do you sign up for the information event on the 20th? And Ming very nicely pasted that in. Reminder that space is limited, so if you're interested, make sure you sign up quickly to snag the one-on-one appointment. Joe asks, if you were diagnosed with PTSD and had hypertension at the time, but didn't file for the additional diagnosis tied to PTSD, can you then file for the additional added issue, which is already in medical records? And if not, what additional information needs to be provided? Summer, did you want to answer that one? Oh, I think she posted that to make an in-person appointment. Yeah, I think that would be helpful, Joe, is to really talk to somebody specifically about that, because linking them is a process, but it's something that we can definitely do. All right. Well, there's a pause. We've got a minute left, and I'm going to quickly do some wrap-up comments. So I wanted to first off thank everyone for joining us today. We really hope that the information that you learned today will help make you decisions in the future, but also help you take advantage of the expansion that's been realized under the PACT Act and also apply for VA healthcare. We would also like all of you to share what you've learned today with other veterans so that we're able to receive, so the folks are able to receive the benefits they've earned. We have the slides. We talked about where they're going to be and where you can get online under stories. And you'll also be able to access a recording of today's session at maryland.va.gov within a few days. And I think that wraps things up for today. So I just wanted to thank everyone for attending. Thank you for your questions. They were excellent. And thanks to all of our presenters and our members that were giving really important information today. We really appreciate it. And we hope that you have a great rest of your day and certainly that you choose VA. We're here for you. Thanks so much.
Thank you.
Thank you so much.
eventually whoever's blocking us doing attachments